Good day and happy Sabbath to everyone. So I'd like to thank Ian for inviting me to speak about home remedies and lifestyle practices to boost immune system. So this is very timely because people are talking about the recent infection that we have. So everyone in the world right now is really concerned, and others are even panicking because of the effect of the virus. Because some people would say this is just a common virus, but as what we are seeing that right now, the infectivity of the virus, the virulence of the virus, and its effect to the host is really worth noting, and that everyone should be looking at it as a pandemic, and this is not really a simple thing that just happened. So we will be looking at briefly what the virus is, um, what does it do to the host, and so we would know as a host, no, what can we do as well to get rid of the infection, and how can we protect ourselves and how can we protect our family as well. Okay, so this is just a brief overview again of what coronavirus is all about. Everybody knows its name. It's COVID-19 because it's a coronavirus disease. And it has started in China in year 2019. That's why it's called COVID-19. So this is also called a novel because this is a new respiratory disease. Okay, so it spreads through the droplets, and then the World Health Organization have already said that it could also be airborne, especially if you are in a closed space, like in hospital, or if this is in the house or in an isolation area. So the symptoms would usually appear 2 to 14 days after exposure to the virus, and then the symptom includes fever, cough, shortness of breath, and then diarrhea. So initially, it's like a flu-like symptom, but it worsens. Okay, so the unique manifestation for coronavirus, in fact, is the shortness of breath. Okay, so now, usually when we get contaminated with the virus, so when somebody coughs out and then when somebody sneezes or when somebody coughs, we're emitting the droplets. The person infected can emit the droplets, and then that droplets can land to us, or it could be in the respiratory system, it could be in our nose. But it's nice because we have a protective mechanism in our respiratory system. So as you see here, we have hair-like projections. These are called cilia that you can find at the bronchus area. And we also have the hairs in our nose, that helps us, that also provides nasociliary clearance. Now, but the problem here is that the viruses are really targeting this cilia, the cilia cells, and then they were able to figure out how to damage the cilia cells, and so the defense mechanism of the lungs were actually compromised because of the cells. Now, these respiratory cilia are actually infected by the virus, and then eventually, when they damage, they slough off. When they slough off, they go to the bronchus spaces, and then together with some of the debris and then the fluids, um, they will occupy the space, and that's the reason why we have pneumonia, and that can be seen in X-ray. But what's actually happening in the lungs in particular. So what the body does, in fact, during infection, really depends on our immune system. So that would be the core of the topic. Okay, so we have our own natural immune response, and it's really necessary for us to be familiar with these cells because we have the innate immune response. We have the first line of immune defense, which includes the natural killer cells and then the monocytes. Now, they don't need any prior exposure to virus or antigen for them to have the immune response for them to kill the invaders. So whenever they see an infected cell, like for example the natural killer cell, whenever they see an infection, then they will directly they does a lot of things. Okay, so like for example your monocytes, you know, can can kill the virus directly. Your natural killer cells can also kill the virus directly or through cytotoxicity. So this is really very important for us to have a very, very good first line of immune response. We also have an adaptive immune response, but sometimes it takes a few days or sometimes it will take a week for this to develop, you know, for this to set in. So it's really important for us to have a very good innate immune response because that is the first line of immune defense. Okay, so whenever we are invaded with any type of virus. So this video here will show you how the coronavirus looks like. So the virus is made up of RNAs. That's why they can replicate. So what they do is they infect the cell, particularly the alveoli of our lungs. So they were able to figure out to get in touch with the receptor and infect the cell. And when they are infected, they damage the alveoli. And this is the example of an infected cell. So what you can see here, the small cells, right? The small cell right here is the natural killer cell. So if this is the infected cell here, you will see a lot of fragments inside. So those are the virus that were able to use the machinery of the cell for them to replicate inside. So what they wanted to do is, in fact, to outburst and then so for them to spread inside the body. But the natural killer cell is preventing that from happening. So that's how important the natural killer cell is. However, if you will see here, according to the reports that we got from China, they were able to find out that the monocytes and the natural killer cells are significantly decreased in COVID-19 infected patients. So what our goal right now is in fact to increase our innate defense because that is the first line that will be compromised by the virus. So we will be talking ahead, you know, in the next sections, in the next coming slide on how do we protect our innate immunity. So basically, when you get infected, 80.9% of cases should be mild only. But there were other patients who get severe symptoms, and then 4.7% will develop in a critical condition. Now, not all patients will get into critical or intensive care units. Not everyone will develop critical conditions. However, as we can see, patients who would usually get into seriousness of the illness are those who have pre-existing conditions. So patients with cardiovascular disease, patients with diabetes, chronic respiratory disease, and abnormal high blood pressure, including patients also with cancer. So, so that will be the point of our topic this afternoon. So you will see here the factors that disrupts immune function. So what you're seeing right now is number one is aging. So because you have been hearing that patients who are elderlies and patients with pre-existing conditions have the highest risk to get infection whenever they are contaminated with the virus. Of course, it also includes malnutrition. So malnutrition means it's either you are taking low nutrients that you need, or maybe you're taking too much of some of the substances that you don't actually need from the food. And then patients with chronic disease, patients with diabetes, cancer, heart disease, like the diseases we mentioned earlier. And of course, patients with undesirable lifestyle. So these are the factors that may disrupt immune function, remember? So first is diet and nutrition, patients who are sedentary, patients who are exposing themselves into physical and mental stress, and then patients who lack sleep, and then patients who are using alcohol and cigarette. So we're not We're fortunate because Adventists are not into alcohol and cigarette smoking, but many Seventh-day Adventists are actually still into having undesirable lifestyle. So we're not exempted. So I want to talk shortly about aging here and the immune system. This article is just showing us that whenever we age, patients are actually having loss of adaptive immunity and also bias towards innate immunity. So that's why this is fostering inflammatory disease and there is a loss of immune inhibitory capacity. But let me emphasize here that aging doesn't only come with a chronological age. So that means that is the age that you see from your birth certificate or your passport. Because a lot of people right now are aging prematurely. So that means you may be at age 45, but your biological age may be that of a 75 years old already because of the faulty lifestyle that we have, and many patients are already into maintenance medication or patients who develop chronic disease, like for example, diabetes at age 35, hypertension at age 36, and then dyslipidemia, and then patients who had heart disease or first heart attack at age 42 maybe. So these patients are actually um, having a biological age that is not corresponding to their chronological age already. So that's why you will see now that there are patients who are infected with COVID, like a 95-year-old patient was able to survive COVID, but we have 45 years old who died of COVID. So this patient may have underlying conditions already and that the immune system is not really working properly. But of course, there are many other factors to consider because it also depends on the number of virus that you contracted with, and then it really depends on the virulence and then the state of your immune system that time of contamination. Okay, so just a very brief review here. In the Philippines right now, as you can see, people aging 55 and over and 64 years old is only 6% of the population. And Filipinos aging 65 years old and over is only 4 years old. The only lesson I want to share you here is that Filipinos are dying prematurely. Filipinos are dying young. Even the life expectancy right now for male is about 68.8 and for female it's 74.3, but the average age of death is just at 62. So that's why you will see here that not all Filipinos may reach an elderly stage. No? So many Filipinos right now are still in their early adulthood, maybe, but they're already suffering from many types of diseases, many types of chronic diseases and pre-existing conditions. That's why it also increases the risk for them to develop critical condition whenever they contract viruses. Now, let's go ahead and look at how do we increase our immune system or boost our immune response. So first we have diet and nutrition, physical activity, mental health, and then sleep. Now in this article, you will find here that they were able to conduct a review on the modulation of immune functions and by foods. And in this article, it was emphasized that foods that decreases immune response includes meat products and ultra-processed food, because ultra-processed food are drivers of metabolic diseases such as heart disease and diabetes. And whenever you're diagnosed with diabetes, you're already considered as immunocompromised person. And of course, it also includes sugar, salt, fat, and additives. Now, I want to give emphasis here about sugar because sugar is a known substance that can reduce immune response. This is not really the right time for us to indulge ourselves into sugar. But please also take note that sugar is hiding from many types of food. So I think this is the right time for us to read the labels. We're not going to be, it's not going to be hard if we are eating whole food plant-based diet. We only got to read labels when we are consuming processed food. So that's why you take note of the carbohydrates, you take note of the glucose, that are included in the content of the food that we're eating. Okay, so foods that are capable of improving our immune function includes, of course, our vitamins and minerals. And then these vitamins and minerals can be taken from multicolored fruits and vegetables that we can eat, including the antioxidants, the flavonoids, and other substances that we need for our immune system to have a good function. And we also need the probiotics and, of course, the amino acids. All of these things we can get if we actually make sure that we have a power plate. So this is one very good example on how do you create a landscape on your plate. Whenever we eat, portion of that should be fruits, grains, legumes, and then the vegetables. So multiple colored, different varieties, so we can get the most of the macronutrients, micronutrients, and minerals that we needed for our immune system. Okay. Next is physical activity. We know very well that exercise has the capacity to protect and enhance our immune response. However, please take note that excessive exercise may be deleterious to immune response. Now, you will see one patient that was reported that he is really eating healthy food, he's into plant-based diet, and is actually into good physical activity. He's into the gym 3 to 4 times in a week, but he still contracted COVID-19. So what I'm looking at in this situation is that being in the gym 3 to 4 times in a week may give them physical stress as well. Because excessive exercise may not do good to the immune response. So that may be one of the consideration in that particular case. So what we only need is about 30 minutes of aerobic physical activity, 5 days per week, and that's already ideal for the immune response. It's just moderate physical activity. You can do seated exercises in the house. You can do stationary exercise in the house. You can visit your YouTube and find some inspiration that you can use there, some bases and some references. Again, sedentary and overtrained individuals are more susceptible to infection. So there are a lot of things that you can do even at quarantine. You can do stationary walk and we can do seated exercise. Okay, stress management and mental health is really necessary in this time of days because people are really anxious. People are really in panic. They're not really sure of what to do. We're fortunate as Seventh-day Adventists because we have a support from the church. We can always watch we can always watch people talking about mental health. We can always watch the releases that we have from the 3ABN, Hope Channel, maybe HSCBN, those things. And we have powerful speakers that can help us and inspire us to sustain having a good mental health despite this time of trouble that we are facing. Please take note that we have neuroendocrine immunology and negative emotions from stress can augment inflammatory pathways. So that's why whenever we are stressed, you will realize that you have a very low immune system function as well. Okay, another one very important thing that I want to emphasize here is sleep hygiene. Sleep is really necessary because this is the only time where our cells can regenerate, repair, and repair. So whenever we lack sleep, 30% of our natural killer cells are actually not working properly. So there are a lot of researches coming out that even modest loss of sleep reduces natural immune responses. So it's really necessary to sleep on time. So ideally, 9 o'clock, 10 o'clock, we should be asleep already. So we have to improve our sleep hygiene. Basically, consistency is the key. Let's train our body to sleep around. If you wanted to sleep 9 p.m., then you should sleep every 9 o'clock in the evening. Or if you're maybe 10 o'clock in the evening, then make it consistent. Then we have to practice buffering before bedtime, slow down before bedtime. When we say pull the plug, that means we should be out of exposure from the screens of our cell phones, laptops, or television approximately 1 hour before sleeping. Then, of course, we have to have a very good sunlight exposure because sunlight exposure provides a sunlight exposure provides a signal to our brain that it's already daylight in daytime, and so the melatonin secretion is being regulated already, so that at night the melatonin secretion will be up, and then your body is sensitive enough in that in that amount of melatonin excreted by the brain, and so we will feel sleepy. Okay, and then of course we have to create a very good sleep environment. That means the bedroom should be a bedroom for us to sleep, and not the room for us to eat, not the room for us to do our chores, not the room for us to do our office work. Okay, so there are other home remedies that we can do in this time of pandemic. So remember, we have to take care of our respiratory system. So whatever we can do at home that can help us get rid of inflammation along the respiratory system, we have to do it. All right. So we have to get rid of having sore throat, coughing, whatever the causative agent may be. Okay, so steam inhalation can really help. This is introducing moist air into the lungs through the nose and then throat for therapeutic benefit. This will help you clear the blocked nose and open congested sinuses. This will also help you allow breathing easily and help you excrete the mucus if you have. So studies would show that steam inhalation improves nasal mucociliary clearance. And then this is easily done, and it can be applied to kids and even elderlies. So this is only 3 minutes doing steam inhalation twice a day. You may add mint leaves if you have available mint leaves. You can find the procedure in Healing Wonders of Water. Okay. Next, here is gargling. A lot of evidences are showing us that gargling can prevent upper respiratory tract infection, regardless of the causative agent again. So whether it be the ordinary flu, again, our goal here is to keep our respiratory tract intact and away from infection, okay, and away from inflammation. So gargling can really help. So this will also attenuate bronchial symptoms, and of course, this is cost-free modality. You don't have to spend anything just to do gargling. So you can do this with plain water using warm or room temperature water. You may also add mint or salt as desired, just to clear your mouth, okay? And then lastly is steam bath. The purpose of steam bath is just to increase our body temperature a little bit. A lot of studies are showing that hyperthermia increases number of monocytes and natural killer cells activity. Again, our goal here is to have a very good innate immunity, or the immediate response of our immune system to viral infection. So by doing steam bath, for example, may help us increase the monocytes and natural killer cells, which are decreased during the time of infection, like the data I showed you earlier. You can improvise your own steam bath at home. You can use a blanket maybe, and then any form of steamer that you can put under the chair. That will do as well. Okay, so again, if you want to see the procedure on how to do steam bath, then you can find this in Healing Wonders of Water. So it's just simple. You just have to sit there for about 20 minutes. Make sure you have towel in your forehead, especially if you're hypertensive, so for us to avoid headache. Okay, so you can also soak your feet into reliable hot water while doing the steam bath, and make sure that while you are sweating, because you're expected to sweat during steam bath, make sure that you're drinking warm water, okay, to replace your fluid losses. Okay, so just a simple review of what we have talked about, because this is just supposed to be a 15 minutes talk. So first, these are the factors that disrupt the immune function. Take note, it is early aging, and a lot of people are aging prematurely this time. So we have to live a healthy lifestyle. So for us to get rid of developing the chronic non-communicable diseases that may increase our risk to develop critical condition whenever we get infected with the disease. And of course, malnutrition, we have to take note of the foods that we're eating. Those nutrients that we need should be taken, and those substances that we do not need, is example, sugar, too much of salt, should be avoided. And then, of course, chronic disease. This is the right time for us to control diabetes, to control our pre-existing condition, because studies are showing that patients who are having pre-existing conditions are the ones who will be developing the critical conditions whenever they got infected with the COVID-19. And then, of course, the undesirable lifestyle. Please take note of the diet, being the physical activity, and then the mental stress, of course, or sleep hygiene. So I hope you learned something from this very short talk. Again, our goal here is to boost our immune system in this time of pandemic. That's the first line of defense. Doctors are the first liner, but in fact, our immune system, specifically the innate immunity, are the first line of our defense. So happy Sabbath, everyone, and thank you for listening.